Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, let's discuss about what are the hormonal imbalances in a PCOD patient. Now, whenever a patient comes to me saying that she cannot conceive, we do certain hormonal investigations which are blood investigation on the second or the third day of the periods along with a baseline sonography. On doing these tests, around 10% of our patients are diagnosed with PCOD which do not have any symptoms at all. Now, PCOD affects around 40% of the reproductive age group women, which may range as early as 15 years to 45 years of age. Basically, the women which I see are for infertility, and they are married women who are unable to conceive in spite of trying for quite a few number of years. PCOD per se may or may not give any symptoms, but primarily is associated with a lot of hormonal imbalances. In fact, it was also called as the Hare-Ann syndrome around 2 decades back, in which it is predominantly having 3 major hormonal imbalances which can be found in majority of the PCOD women. Hyperandrogenism is one of the features. Now, what is this? Androgens are the male hormones which are also found in the female bodies. Now, whenever these male hormones oversede the female hormones, this is when there is a hormonal imbalance, and because of which the female starts getting male-like features like having male pattern baldness on her head along with a beard or a mustache, or that is the amount of hair growth that the patient may encounter, which is called as hirsutism, and along with this she may have pimples on her face and a very thick skin like the males. Apart from the hyperandrogenism part, insulin resistance or hyperinsulinemia is another hormonal imbalance that we encounter. Insulin is a hormone which keeps control of the blood sugar levels in our body. PCOD can cause hyperinsulinemia, as a result of which this control of sugar in our blood is damaged, as a result of which there's too much of sugar in the blood, as a result of which it results in diabetes mellitus or hyperglycemia. Now, whenever a patient has diabetes or has signs and symptoms of diabetes, she generally comes up with increased weight gain, or if she is not reducing weight in spite of trying very hard or maintaining a restricted diet. Sometimes she may also come up with urinary infection or thick skin on the nape of the neck, which is also called as acanthosis nigricans. These are primarily the hormonal imbalances which are present along with PCOD. Now, patients who come to us mostly and very frequently complain of irregular menses or no menstrual cycle at all other than taking medicines. Now, this is something which is definitely alarming in a PCOD patient, and one must be vigilant about their menstrual cycles. It just indicates that because of too many immature eggs in your ovaries, per se called as polycystic ovarian syndrome, the good quality eggs do not get liberated, or sometimes there is no rupture of the egg, as a result of which your hormones go into imbalance and the menstrual cycle is the first thing to get affected. If you are facing any of these symptoms, do visit your IVF physician or your gynecologist to make sure whether you have PCOD, because PCOD, if it is diagnosed in earlier stages, is absolutely curable with just diet, exercise and nutrition. If it becomes too severe and you stop your menses, that is a time when you have to consult your IVF physician, because you might be a candidate for IVF technology to bear a child because of your PCOD problem. Thank you.